Hello, everybody. This is El from Cornell's Dairy Extension, bringing you another round of coronavirus boosters. This is week of August 23rd, and the good news of this week is that FDA approved first COVID-19 vaccine. This would be the Pfizer vaccine that will from now on be known as Comirnaty. The full approval is for prevention of COVID-19 disease in individuals 16 and older, while the use of vaccine for individuals 12 to 15 years of age will remain under emergency use authorization for now. Now, the bad news of the week, which has actually been bad news for the past 2 months, is that the national numbers have been on a steady increase since July. New York State is currently staying relatively low compared to other states, while the 3 states that got hit the most are Florida, Mississippi, and Louisiana. The entire situation looks very much like the increase we experienced in October and November of last year. We have seen a 36% increase in cases in the last 2 weeks, as well as 43% increase in hospitalizations and 95% increase in deaths. Now, why do we see this increase of hospitalizations and deaths? Because we are mainly dealing with this new variant that is not just better at infecting individuals, but also able to cause more severe disease that some of our treatments, like certain monoclonal antibody treatments, are less effective against. But even with this Delta variant present, this should not be happening. Because yes, we have more than enough vaccines that this should not be happening, at least not at this scale. Vaccines we have are still very much effective against Delta and other variants, but the key is for a population to get vaccinated. People that can't be vaccinated should be vaccinated, and the ones that are not vaccinated should have the risk and the amount of exposure they are putting themselves into in mind when they're leaving their homes. So please mask up. The data doesn't lie. The vaccinated people that are getting infected represent only a fraction of all people getting infected in the US. And don't forget that the vaccinated group includes more than 80% of people above 65 years of age. It includes also all people that are immunocompromised, that would absolutely not stand a chance without the vaccines. If you look at the vaccinated people that are getting infected, you will see that half of them are people that are in one way or another immunocompromised. Yes, there are people that don't have fully functional immune system on which actually vaccines rely on. But even these people are benefiting from vaccines because the infections they might get are less severe, they're less likely to be hospitalized, and they're less likely to die. Guess what? They could benefit from vaccines even more if everybody around them got vaccinated. Okay, so this is where we are today. Definitely not the best place. But the question is, what should food industry do in this situation? And again, the industry should focus on getting all employees vaccinated. The difference between me recording this coronavirus booster, asking everybody to get vaccinated, is that the food industry should be able to reach every single employee, and preferably on a more personal level. Identify where the vaccine hesitancy is coming from, identify the barriers, and deal with them. Educate your employees about the benefits and risks to not just them, but also to employees, and in the end, also to entire community. Offer support, give them time off, pay time off, use other incentives to get as much of your workforce vaccinated as soon as possible. When it comes to educating your employees, we have done a lot of work during the last year and a half, and most of it can still be found on our webpage, which is still being regularly updated. One part that I would emphasize is the full 11-module course, of course, free of charge, that provides food industry managers and supervisors with the tools to manage the impacts of COVID-19 pandemic, as well as any other outbreak of respiratory virus. Scientists are saying this is not the first one, and it's definitely not going to be the last one, which is why this is a good tool in your toolbox if you want to deal with not just this current pandemic, but also be ready to deal with the future pandemics. And actually, if you're operating in New York State, being ready is now actually a requirement according to New York State HERO Act. If you're looking for more tools for this toolbox, On our page, you can find other trainings, you can find decision trees, SOPs, checklists, verification, spreadsheets, and so on. We are still having sessions of our office hours. We are definitely ready for those really, really tough questions. Our next session is already scheduled and will be held on September 9th at noon Eastern time. So please register for that. If we go back to what food facilities can do, as we said, food facilities should work with employees and do everything they can to get as much of the workforce vaccinated as soon as possible. Next question is what to do if this doesn't work? And there are many facilities that gave it their best and still failed. If everything else fails, facilities should consider making vaccination a requirement. Since this is a matter of employee health, there is a legal base to make this a requirement. And actually, 2 of our last virtual office hours covered this tricky topic. And this is also something you can find on our webpage. So the recording from June 29, where Professor David Sherburn was invited to give us information on what are some of the things to think about when considering making COVID-19 vaccine a requirement. And in our last session on August 3rd, Melanie Newman from Matrix Science International continued the topic on legal and practical considerations of vaccines and other COVID-19 control strategies. The same session of office hours from August 3rd also includes a talk from Professor Martin Wiedmann, where he reviews the COVID-19 control strategies available to food facilities, including how to roll back on some of them based on risk. And this is my last recommendation to you. If you already rolled back on some of the control strategies like mask wearing and keeping social distancing, make sure you review those and have them ready to be implemented again if the risk calls for it. For example, if you have a lot of employees that are of risk of developing severe disease, if community spread is high, if vaccination coverage in your facility is low, and if your ability to detect new cases is low, then maybe bringing back some of these traditional control strategies is in order to reduce the risk to the health of your employees, and finally also to continuation of your operation. Now, with this in mind, I will still include this slide. If you already rolled back on mask wearing and social distancing, please make sure you at least keep washing your hands with soap and water, because this one goes far beyond just COVID-19. Thank you, and let's keep each other safe. The Coronavirus Booster Series is part of the program supported by USDA NIFA and brought to you by Cornell's College of Agriculture and Life Sciences, Dairy Food Extension, and by Cornell's Institute for Food Safety.